Alright, so there's another variant of appendicitis, and this variant of appendicitis is actually like behind the caecum. Alright, so that's why they call it retrocaecal appendicitis. Anything retro means what? It is at the back. Okay, so if you have an appendicitis that is at the back of the caecum, okay, you call it what? A retrocaecal. And let me tell you guys, they actually use the clock to state the location of appendix. Okay, so it's just like your clock at home. So if it is retrocaecal, you could say it is at 11 o'clock. Okay, but that's just some extra wordings for that. So this retrocaecal appendicitis, we'll be talking about it. We'll define it. After we define, we'll talk about the symptoms of this condition. We'll talk about the possible diagnosis. They talk about the treatments that can be involved. Okay, they will talk about what the possible complications that could actually also result from what this type of appendicitis. So we said that the retrocaecal appendicitis is actually what a rare variant of appendicitis, and in this condition or situation, the appendix is located behind the caecum. All right. The caecum is actually what? The first part of the large intestine. Alright, so the first part of the large intestine is the caecum. So the appendix is behind. Okay, and this is actually rare. Okay, so it has some unique complications and all that. Right, so this anatomical variation can make diagnosis and treatment more challenging. So this is one of the first problems with what? Appendix being behind the caecum. Alright, so talking about the symptoms, you have abdominal pain, often starting in the upper abdomen and radiating to the lower right abdomen. You have nausea and vomiting. You have fever. You have loss of appetite. You have what? Abdominal tenderness and guarding. That's muscle guarding. You have diarrhea or constipation. You have what? Abdominal distension. Okay, then of course the diagnosis, if you want to confirm, because it makes diagnosis challenging, so you might want to do some imaging to see the internal environment, like what CT scan, MRI scan, just to confirm the location of the appendix. You could also do ultrasound. You could do some laboratory tests like what? Blood count, electrolyte, physical examination. All right, then treatment is at this location that this appendix is found behind the caecum is actually a dangerous location, so you need to actually rush up with the treatment. Okay, so you do an emergency appendectomy. That's surgical removal of the appendix. It's an emergency because this location is not nice, so you need to rush up. All right, they can also give antibiotics just to manage the infection. You could do some supportive care like fluid replacement and pain management. You can also do some laparoscopic or open surgery for it. All right, now this laparoscopic or open surgery is just depending on the severity and location of the appendicitis. All right, so just take a look again. If it is at the back, they call it what? Retrocaecal. That means the appendix is behind what? The caecum. All right, then talking about the complications, which is the most important reason why we study what? The variant of appendix, because each variant actually has their own problems and all that. Then for these complications, if it is behind the caecum, there's what? A higher chance of perforation or rupture of the appendix. Okay, then if it ruptures, or it can irritate the peritoneum, okay, resulting into peritonitis, which is inflammation of the lining of the abdominal cavity. Then abscess formation. All right, abscess formation to intestinal obstruction, increased risk of complications due to what? Retrocaecal location. All right, so appendix being behind this place is actually not nice. Okay, so that's why we actually study this retrocaecal appendicitis on its own. All right, so that's all you guys really need to know about retrocaecal appendicitis. See you guys pretty soon.